Osteoarthritis, the subchondral bone connection to injuries. Imagine a joint that's been through a tough fall or twist. Did you know that injury might set off changes deep beneath the cartilage? That's because the layer of bone just below the cartilage, called the subchondral bone, plays a big role in osteoarthritis. When a joint gets injured, it can cause abnormal stresses on this bone. These stresses lead to tiny cracks or microfractures in the subchondral bone and at the interface where the cartilage meets the bone. Over time, these microfractures trigger the bone to try and repair itself, but this process often becomes imbalanced. The bone responds by increasing its turnover, becoming harder and thicker in some areas, a process called sclerosis. Early on, these changes can be seen with magnetic resonance imaging, or MRI, which shows areas of inflammation and microdamage in the subchondral bone. If the joint keeps bearing abnormal loads, healing becomes difficult. The ongoing damage allows inflammatory molecules and joint fluid to seep into the bone, making the remodeling worse. This leads to a cycle where the bone tries to repair itself but ends up becoming less resilient and more prone to further damage. The bone may increase in volume and thickness, but it becomes weaker and more prone to fractures. Previous joint injuries are a major risk factor because they change how the joint bears weight. Damage to the cartilage and underlying bone from injuries creates microfractures and inflammation that speed up osteoarthritis. As the cartilage breaks down, the subchondral bone responds by thickening and hardening, but this makes the bone less able to absorb shocks. This weakens the joint further and accelerates cartilage loss. Understanding this connection shows why early treatment after injuries is so important. Addressing abnormal joint stresses early can help prevent or slow down these damaging changes in the subchondral bone. Imaging techniques like MRI can detect early signs of bone damage, guiding doctors to intervene sooner. In simple terms, injuries cause abnormal stresses that damage the bone beneath the cartilage. This damage triggers a remodeling process that weakens the bone and speeds up cartilage breakdown. Because of this, the health of the subchondral bone is a key factor in how osteoarthritis develops and progresses. Recognizing this link helps in developing strategies to protect joints after injuries and possibly prevent the disease from worsening over time.